We'll give folks another minute to join from the waiting room, but we can go ahead and move to the next slide. Nice to see you all. Hope everyone's staying warm and dry on a very rainy Thursday. As always, we'd love for folks to introduce themselves in the chat. If you take a minute to introduce your name and your organization so we can see who all is here. Okay, I think we can go ahead and get started. Thanks everyone for introducing yourself in the chat. Welcome to today's Connecting for Better Health meeting. Our coalition meets twice a month, except for as we get closer to the end of the year, this will be our only November meeting. As a reminder, we won't be meeting on Thanksgiving Thursday, but we're so excited to see you all today. The vision of Connecting for Better Health is that every Californian and their care teams have the information and insights they need to make care seamless, high quality, and affordable. We start every meeting with a reminder of our 4 policy priorities that we set together as a coalition about a year ago. Later on in today's meeting, we'll talk a little bit about our 2026 policy priority setting process. We're so excited to get feedback from all of you as we move towards the end of the year. But our 2025 policy priorities are 1, establishing data exchange framework governance and accountability, 2, identifying dedicated and sustained funding streams, 3, strengthening social services data sharing, 4, advancing high quality and actionable data sharing. Can you go ahead to the next slide? Today's call is going to focus primarily on privacy and consent-related updates. We have Planned Parenthood Affiliates of California here, who will share some recent legislative developments that impact AB 352 implementation, as well as our new toolkit and a new frequently asked questions document that C4BH developed in partnership with Planned Parenthood. Really excited to share these new materials with you all. And then that will be followed by a presentation by Amit Trivedi on the Shift Collaborative's work to advance granular privacy and consent. So with that, we can go ahead and move to our first AB 352 section. And I think I'm bringing up Sophia Pedroza from the Planned Parenthood Affiliates of California team. Sophia, thank you so much for being here today. We'll hand it over to you.
Thank you, Stephanie. Good morning, everyone. As Stephanie mentioned, I'm legal counsel with Planned Parenthood Affiliates of California and the California Planned Parenthood Education Fund. To rewind us a little bit back to 2023, which feels like it was approximately 26 years ago at this point, AB 352 was passed as part of a larger swath of SHIELD bills that were looking to enhance protections for medical information, legal protections, et cetera, related to reproductive health care after the Supreme Court overturned Roe versus Wade. And AB 352 in particular focuses on information, medical information stored in electronic health records. And so I'm going to briefly go over the provisions. First, as of July 1st, 2024, businesses that store, maintain electronic medical information are required to create certain technological capabilities, the ability to limit access, prevent certain disclosures, to segregate. And these requirements are with respect to gender-affirming care, abortion, and abortion-related and contraceptive medical information. I want to note that this is not a requirement to segregate. It is a requirement to create the technology to do so. Next, I'm going to skip to the bottom cell for a moment. The provisions of AB 352 have a separate requirement for providers' plans, et cetera, that are only for abortion and abortion-related services. And this is a requirement to not knowingly share information with out-of-state entities absent patient authorization or an applicable exception. Understanding that the technology requires some development, there is a safe harbor that is in effect originally until 2026, but this year it was extended until 2027. So there is still some time for providers who are working in good faith with their vendors to implement this technology in their workflows. Relatedly, participants in the state data exchange framework are not required to exchange information related to abortion and abortion-related services. I'll pause to see if folks have questions about the provisions, but otherwise I will pass it back to C4BH to talk about the really important work that has come from what is necessarily a long-term implementation goal.
Thank you. We'll keep an eye out for questions as we work through this section, but let's move to the next slide. A piece of work that we're really excited and grateful for Planned Parenthood's partnership and also for support from Cedars-Sinai is that to help organizations meet these objectives under AB 352, C4BH led a 12-week project, one of our community design studios, to explore both the policy and technical considerations that California organizations are expected to incorporate into their workflows and their technology. The Community Design Studio, just as a quick refresher for folks, set out to define what is required under AB 352 law, trying to understand what these requirements were and how organizations should approach them. We created 3 user journeys and use cases around abortion-related care scenarios. Also developed what the functional and technical requirements for exchange are in relation to these use cases and these user journeys as an individual enters and leaves California to receive care. And then also part of this work was also around identifying the considerations and risk mitigation strategies for implementation. So quick refresher on what we focused on this summer to really help operationalize AB 352 for California organizations. And coming out of that work, we are excited to now have available an AB 352 toolkit, which Maya just added in the chat. And this is a comprehensive collection of resources coming out of the AB 352 Design Studio, along with continued work to help organizations understand and meet AB 352's data protection requirements. It offers a roadmap for how organizations can align their technology, their policy, and also their practice using real-world examples, technical considerations, and other tools that are available now to support implementation around around safeguarding abortion, abortion-related services, contraception, and gender-affirming care. You'll see here in the toolkit that we have our 3 use cases and the data flow diagrams. We also have a new FAQ that we'll dive a little bit more deeper onto the next slide here. We've also developed implementation considerations for how to approach these data segmentation requirements using more technology. And then also additional materials around a case study, really wrapping up what our learnings were from the Community Design Studio, data set requirements, and also synthetic data for organizations to support their testing. And one more slide here on the FAQ. Thank you, PPAC, for all of your work to identify really what are these common questions and provide some clear answers for folks around them. You'll see in the FAQ, it covers a variety of topics. I believe we have 13 questions total. Going from a high level on how does AB 352 protect certain reproductive health, gender-affirming care information in California. It dives a little bit deeper into the specific requirements for different types of organizations across the state, such as California providers versus our EHR vendors. What are the expectations there? And then we also dive a little bit deeper into some of these more implementation-focused questions on how does AB 352 relate to the data exchange framework? What are considerations for legacy data? And we think that this is a really helpful tool for folks as they move forward with implementation. And Sophia, would love if you have any additional comments on the FAQ and how you guys are looking to use it.
First of all, thank you again for your collaboration with this work. I will note that we passed AB 3, or we, advocated to pass AB 352, not because it would be easy, but because it was necessary. And so having the invaluable insight from folks in the Community Design Studio was really informative and, directed us to answer the most pressing questions that folks were asking and collaborating on as part of this process. And so I really can't, reiterate our thanks enough, not only to C4BH, but to all who participated. And we hope that these resources are responsive to what folks are working on.
Sophia, can you share a little bit about how you envision the FAQ being used? Like what audience maybe might get the most out of it? Who can folks on this call share it with? How else can we get the answers into the hands of people who might be asking these questions?
That is a great question. First, I think that public education on this is really key. Anyone who's sort of in the health information sharing space should be aware of the caveats that are in state law that protect sensitive information in medical records. If, especially if someone is a covered entity or think that they might be a covered entity by AB 352, the FAQ is a great one-stop shop to sort of get your questions in order, speak to counsel if you need to about your particular situation and how things might apply. But I definitely encourage sharing broadly, there's a wide swath of entities that are listed in AB 352, right? Providers, pharmaceutical entities, vendors. So I definitely think that it's important to help folks sort of clarify how AB 352 might apply to them and their institutions.
Thanks. And the AB 260 was just signed last month, right? Extending the safe harbor exemption. Are you hearing more from folks since that development? Less so, different questions?
What I have noticed just in our, informal chats with folks as we come across them, there was really an uptick in anticipation of a January 2026 deadline for providers to, meet the safe harbor moment. Once that was extended, I noticed that folks sort of felt like they had a second to breathe. Um, and a chance to reevaluate. And so while a lot of really great work has been done within many institutions with many partnerships with our vendors to implement this technology, we recognize that it's an ongoing situation and that there is a realistic time that's necessary between a vendor releasing even what is a hypothetically perfect solution and the time that's necessary to implement that within a provider specific situation.
I just want to raise our hand as being a sounding board. If there are questions, we'd be happy to collect them and then work with Planned Parenthood and others to be able to address those questions or other areas that maybe I know that was out, we deemed out of scope during the AB 352 work, with our design studio work, like what happens with results data and pharma script data of orders. There's going to constantly, as you just said, Sophia, things are going to change and things are going to come up. So when there are those questions and when there's those scenarios, we would love to be a clearinghouse for those, and we can then make sure that we are following up diligently too.
Any questions from the group for Sophia? Okay. Well, Sophia, thank you so much for being here today and all of your inspiring and impactful work on this topic. We look forward to continuing to share out the FAQ with many of our coalition partners and hope that you all find it to be a useful tool in these ongoing complicated conversations. Okay. Can go ahead and move on to our next agenda item, very closely related and certainly intertwined with what we just spoke about. Really excited to have Amit Trivedi with us today, who I know many of you know from the work with the Shift Collaborative. So Amit, thanks for being here today. I'll hand it over to you. I know we're gonna sort of dovetail into AB 352 again as well, but excited to learn more about the work of the Shift Collaborative and how it is intertwined with so much of what Connecting for Better Health is trying to do.
All right. Well, thank you, Stephanie, Timmy, Maya, the whole Connecting for Better Health team for having us on the call. It's a real pleasure to share some of the work we're doing at the Shift Collaborative. And it's really even more of a pleasure to work with all of you to see some of this work that we've been doing in theory have a home to move it into practice. And so, operationalizing AB 352 is also a goal of Shift. And it's a goal that was part of our mission before the law existed. So we're ready to be here to support it. So why don't we move forward with the next slide? A little bit about Shift. We're an independent, nonpartisan collaborative, and we're dedicated to advancing safe, patient-empowered health information sharing. We're grounded in the concept of equitable interoperability, which really means in today's world, patients with sensitive data are often forced into an all or nothing sharing paradigm. And what that means is often the people who need the interoperability the most aren't getting it. And so we're developing the technologies through open standards that exist and are in use today to help operationalize the ability to have granular computable consent and granular data segmentation. Next slide. And so, like I mentioned, today's systems force patients, especially if you have sensitive data in your health record, into this all or nothing data sharing, especially if folks don't have the capabilities to segment or redact data and based on patients' preferences. And so this all or nothing data sharing paradigm leads us to either oversharing sensitive data, which could lead to unintended safety, legal stigma risks. Also leads us to potentially withholding all data, and that leads to gaps in care. And so what we're proposing, or what we're evangelizing, is the technology to support granular consent and data segmentation. And we're not recreating the wheel. And through this technology, providers will get the relevant information they need. Patients they're empowered to share the information that they want to share and protect the information that they want to protect. And in the healthcare system, it improves trust and it improves the care engagement process. Next slide, please. And so, why now? Well, I mean, AB 352 is here, right? So now the policy, the mandates are coming up to what the technology requirements are. And as I mentioned, there's a lack of trust in the system. Today, sensitive data can be weaponized if it's not protected. There's always been a fear of stigma and misuse of health data, and that leads to an avoidance of care. In today's systems, without implementing the proper safeguards, you can unintendedly expose victims or patients to more harm. And then today we see it. There's a proliferation of new and updated state data sharing regulations, and that further complicates our landscape. And ultimately, it's our belief that all patients deserve control over what they share. And so today, in our post-Dobbs world, data sharing can expose patients and providers to all kinds of risks. That's why AB 352 was put in place, and that's why we're working together. Next slide, please. And so AB 352, the design studios by Connecting for Better Health and Shift. We have shared goals and we have complementary roles. I didn't mean for that to rhyme, but it does. But part of that is, we're all focused on protecting sensitive reproductive health, also behavioral health information, substance use disorder information, SDOH information. And then there's a ... because sensitive data could be dynamic. What may be sensitive today, not sensitive today, may be sensitive tomorrow. And Shift is working on the technology to support that. And together, we're all advancing the understanding and implementation of granular data segmentation. What is it? How can you do it? Computable and granular consent. The law may not require it, but to enable actual data sharing that's patient empowered, we need to be looking at this. And then finally, there's national perspectives and rule sets to support this, but now we're looking at how can we support this at the state level, as a number of states, California leading the way, are putting in additional privacy protections for their patients. And so Shift was a proud participant in the Design Studios sessions. We had a number of folks from our collaborative participate. I think we share a pretty good audience. We supported helping develop some of the use cases, since we're also developing similar use cases. We helped with some of the implementation guidance and some of the info you're seeing in the FAQs. And we're also both working on technical sandboxes. And I'm in Oceanside, California. I know that being near the beach, everyone has their own flavor of the kind of beach and sand and water and everything that they like. So sandboxes are all different. Sometimes we joke, you've seen one sandbox, you've seen one. But from our partnership from the beginning, we've been looking to align our work so that we're not recreating the wheel and that we can feed each other content and we can support the community together. And we'll talk a little bit more about that in our presentation. Next slide, please. And so, why haven't we solved this problem yet? Well, that's one of the big reasons the design studios were put in place, right? This isn't just a technology issue. If that was it, I could just point you to the standards and we'd be done. It's not just about implementation by one entity because consent needs to be enforced and respected. And the concept of granular segmentation, granular consent needs to be understood by multiple stakeholders. And these multiple stakeholders need to come to consensus on a number of pretty complex issues that are nuanced around patient privacy, patient safety. And then there are many edge cases, many nuances when you're considering these types of exchanges. And that's why the use cases that we use to communicate these stories are really important. And it's also important not to recreate the wheel every time you bring or restart the conversation every time you bring in a new entity. So we need to have those mechanisms to bring people on board, get them up to speed quickly, and then put them to work because there's a lot of work to do. And we've been saying to date, there hasn't been alignment and there hasn't been the urgency to solve this problem. Next slide, please. And so this slide, this is going 15 years back. So data segmentation for privacy, 2011, and we're looking at it from the CDA standpoint. What's changed over time? Well, things like FHIR. So we've moved from document-based exchange to the ability to share data at a granular level. And through FHIR, we have updated and improved standards and profiles to support computable consent. And I'd tell folks to take a look at the IHE patient consent on FHIR profile. And then we have updated FHIR DS4P, which is data segmentation for privacy standards as well. Next slide, please. Well, so since we've had all these pilots, since we've had all these standards, why didn't it work? Well, so there's a number of reasons. One, there's a narrow scope. So, we've made some progress on 42 CFR Part 2 data sharing and not sharing, but now we have other categories of sensitive data as well. And that's why I also shift feels that sensitive data is dynamic. And so we need to be looking at a broader category because those categories are going to expand. We've had, technology that just wasn't there before. We didn't have NLP, we didn't have FHIR when it first started, but we do now. A lot of these implementations were regional only, no nationwide scalability plan. And, that's the danger we run into now as different states move ahead and other states might fall behind. I bolded this one section because this is what I feel is a real bottleneck and a real challenge today. The missing value set that supports this privacy tech infrastructure. So there is currently no nationally stewarded and maintained VSAC value set, but we are working on that. And I'll tell you a little bit more about that and how you can help with that as well. And then finally, there's a lack of implementation guidance. Data segmentation for privacy is a certification criteria if you follow ASTP Health IT certification. It's an optional criteria, which means most people aren't doing it unless they have a good reason to, which is a mandate or their customers are asking for it. I know this because I did testing and certification for about a dozen years, working with CCHIT, Verizon's ICSA Labs. So I probably passed and failed every EHR out there, over those 12 years. And data segmentation for privacy has been on the radar, but it's always been kind of a kick the can issue. And Timmy, we talked about that in our panel. Because folks are going after low-hanging fruit, and to some degree I don't blame them, because there's a lot of work to do, but the time is now to really get on this. And so next slide, please. And I do have to mention, the biggest thing also is the lack of funding. That's also, not just funding these tiny projects, but looking at the big picture. And then the alignment of incentives as well. But we're having a little bit more of that in terms of, mandates, penalties, and incentives as well. And so our approach at Shift, we're looking at keeping it an open organization and casting a wide net. We have over 300 stakeholders that come and support our work, and they represent expertise in a wide variety of domains. It's not just a technical group. We have ethicists, we have policymakers, attorneys, very much like some of these DXF design sessions. It's a nice, you need that diversity and thought to get to the right answers. Again, there's a lot of work to do. So we try to focus on high impact use cases. We're focusing on building on existing frameworks, existing tech. I'll introduce some of my technical colleagues in a moment, but we've been living this standards and interoperability and now privacy landscape for a long time. So we really feel the pain of making sure that the wheel is not recreated and that we do leverage the work that has been done. Because like I said, there's a lot of work to be done. So let's not start over, let's build. And so a lot of our work is, ensuring that we can demonstrate the art of the possible and getting proofs of concepts out there as well. And so we do this through our work groups and our work streams and our advisory groups. And we have a couple other techniques and tools that we use to get our work done. So next slide. So these are our advisory groups and work streams. They're open for anybody to join. So, feel free to follow up and ask for more information if you're interested. But we have a terminology work stream and technical work stream that is closely aligned with HL7 work. Our technical work stream is led by Dr. Mohammed Jafari and John Murky. They're our technical advisor and technical director, respectively. Folks probably know Mohammed from the DXF calls, and anybody who's been in health IT, interop, privacy, or security probably knows John. He's the guy that when people come to me for answers, I go to John just to make sure I'm double checking and I'm correct. He's in the chat and can also answer questions when he's around. We also have an implementation work stream. The implementation work stream focuses on running a modified Delphi process, which I'll talk a little bit more about, but that ensures that we get consensus from a wide variety of our expert stakeholders on a number of these thorny topics. And then finally, we have 4 advisory groups focusing on clinical expertise, legal and policy, ethics and equity, and patient perspectives as well. And the patient perspectives group is run in conjunctions with Open Notes. Next slide, please. And we also have some great collaborative partners and our governing board as well. So AAP, AMA, Drummond, Certifier Testing Lab. We have folks from the EHRA. That way we are always checking in and making sure we have alignment with health IT vendors when we're proposing solutions. Very close to the standards world, we're working with IHE USA on our board, and we've had ASTP as an ex officio member as well. Next slide. We have some great collaborative partners like Civitas, where we helped support their consent workshop, the Health Trust Institute, where Timmy and others just were on a panel at their first health privacy conference just earlier this week. As I mentioned, HL7, Open Notes. We worked on use case development with the Gravity Project, white paper development with Sequoia Project, and we've had a ton of work with the Connecting for Better Health team, and there's only going to be more as we really converge on our work around our sandboxes. Next slide. All right, these are our 4 use cases. By the way, you can go to our website, www.shiftinterop.org, to get any of this information. Our key 4 use cases focus on older adult behavioral health data. Use case 1B is the adolescent reproductive health data, which aligns super closely with the work out of Connecting for Better Health. Dr. Hannah Galvin, our founder and board chair, was a key person working on that use case with the Connecting for Better Health team. And so we do talk about many of the same issues in that. Then we have the adult social drivers of health data, which also includes things like immigration status, intimate partner violence, and we worked on that with Gravity Project and Futures with Violence. And then the last use case is the commingled maternal infant health data. So these are our focus areas, and we're working on them one after another to operationalize them in our sandbox as well, so people can have an opportunity to get hands-on with some of these. Next slide. I mentioned our Delphi process. So it's basically a way that we can survey our stakeholders and get some really nuanced questions answered. And for each session, we're actually on the number 4 one right now, working on algorithmic decision support and AI and ML, and how redacted data affects, machine learning, AI training, data sets, et cetera. I hadn't had the opportunity to participate in some of the earlier ones, but I am participating in this one right now, and it's eye-opening, especially coming at it from a technologist standpoint and a patient standpoint, and then hearing some of the providers on the call as well. One of the things I thought was really interesting was when we started talking about redacted information and what kind of alerts or notifications a provider should get if patient data is redacted. I, for one, always felt, and part of it's my security background, that you need to give some kind of hints. You let me know something so that I don't have to dig on my own. But we actually heard the opposite from a lot of the providers on the call. If I'll quote them, they were saying it's literally my job to find out what's wrong with the patient or what the patient is here for. And I expect that there's going to be gaps in the record. So really, they were looking for, if the patient said, don't share this data, they expected that data not to be shared without any kind of warning or hint. Now, there's other opinions and topics on that too, and we're going to have a white paper or papers that go through all of that as well. But, there's a lot of nuance in these use cases. Next slide. All right, and this is a big one. This is our terminology work stream, and we're doing that in collaboration with the HL7 Cross-Paradigm Sensitive Data and Sensitivity Flags Library and Guidance Project. Like, I thought I named things like, yeah, anyway. We'll leave it at that. But now this group is working on the value sets that define what sensitive data is, how you can flag that information, and it's really the linchpin to computable consent and granular data segmentation. The value sets that are out there right now are over 10 years old. And they're not state specific. And right now, that's the activity that's going on, trying to update and modernize those, trying to target the areas that are that are specifically referenced in different state regulations. And we're moving as fast as we can, but we could be moving faster on these value sets. We're working on a national level as well as state level. And so I know there's a lot of work being done on the California DXF sets as well. Next slide. And our technical approach, this is embodied in our sandbox. So our focus is on showing how data segmentation for privacy works by creating a reference implementation and different artifacts to help developers, implementers, policymakers really understand DS4P and actually get their hands on it. It works if you can granularly tag data at creation or ingestion. And the way you granularly tag that is through understanding those value sets and mapping that to the data. Our technical approach is based on FHIR-based consent management and real-time enforcement of sharing of rules. And this is all quite in line with the DXF. Next slide. This is our technical team. Dr. Hannah Galvin, who wasn't able to join us today, is our co-founder and board chair. I mentioned Dr. Mohammed Jafari, he's our technical advisor. John Murky, our technical director. Chandra Sengupta helped develop our sandbox, and I support strategy and comms. And I'm going to go through this next part faster because I know I'm a little bit running over, but now we're getting to the good part, of course. So the Shift Sandbox. We had always envisioned creating a product or something more hands-on for the community. Our original goal was to house demonstrations, the same demonstrations we would do at the Interoperability Showcase at HIMSS and other conferences. What we were running into was having to stand up a demo, get a couple of vendors together, and then redo it again every 6 months or 8 months. So we wanted our own. And so we grabbed a couple open source technologies. We're using OpenMRS and MedPlum as example health IT systems, and we're demonstrating our use cases. And we're starting with like an EHR to EHR transaction, then we're going to move to other paradigms. We're going to look to enforce changing patient preferences and integrate that with the full architecture of security labeling, consent management, enforcement of new consent, and revocation of consent as well. It's a stepwise project, and we're at 2.5 right now out of this 4, with 1 or 2 use cases out of our 4. But that's our work going ahead for the next year. Next slide. So in October last month, we finally launched our MVP of our sandbox. And I've worked closely with Richard from Connecting for Better Health as he's shared his sandbox information, development plans, and roadmap. We did as well. And none of it's secret, so everyone's welcome to come to our technical work stream or calls and learn more. But basically, this sandbox houses all of our use cases and gives people an opportunity to walk through them. Next slide, please. So the 2 main pieces of it are the Use Case Explorer. That's the main module. And so part of this Use Case Explorer, we start with our Shift use cases, but the vision is to use it as a use case designer in the future, since this is being kind of templated. We start with the narrative summary. Next slide, please. Where you basically get the story of the patient, who they're sharing with, what are their considerations, why do they not want to share this, what are the different factors that are in and out of scope. Next slide. The next piece is the patient data snapshot, where we pull the data using FHIR-IGs. We pull the data into an EHR. We can show you at the granular level all the different patient data and FHIR resources. And so this would be the source of truth of the patient record, if you want to think of it that way. Next slide. Then we have the configurable sharing preferences matrix. It's a little messy now, but we're going to clean it up. So it's right now you're looking at the super admin view, but we're going to have different views that are more like patient facing and so forth. But this is where patients can visualize, simulate their consent preferences. Next slide. And then finally, we have a redacted record viewer, which shows the before and after having applied consent preferences and any redactions based on the patient preferences and any state or national laws or regulations. And then finally, the other module that we have is a set of workflow demonstrations where we're starting with OpenMRS to MedPlum to demonstrate how you can send information from one system to another and have it go through the entire labeling and tagging process. And then we're doing other exchanges like MedPlum to MedPlum, OpenMRS to OpenHIE, and we're eventually going to open up an API layer where other folks can test their own systems to validate how things are sent, how things are received, and ensure that their implementations are working correctly. Next slide. This is our technical architecture. You can go to our website for more information on it, but it's just a high-level diagram of how this all works. And maybe we'll share that for another call, another half hour. Next slide, please. And finally, I was going to say, we're going to make these modules that I talked about available as standalone modules as well. So that way, folks can use those as open source tools inside their own organizations or extend them in their own implementations. And that's why our sandbox isn't really just for developers. It's for policymakers. It's for terminology stewards, standards folks, researchers. It is a little bit more hands-on and visual, but you can download, JSON files. You can test API access, all of that too. So, we're trying to support the community, and it's not just a technology sandbox as well. Next slide. And ways to get involved. Would love for you all to join us. A number of you already do, and it's great to see so many familiar names and faces on the chat. You can learn more about what we do by reading our white paper. I was going to put a shout out if anyone is involved with or knows of a patient advocacy organization, Planned Parenthood. We're looking to add a board member in this space. And then terminology expertise. This is, like I said, this is the bottleneck that's holding us all back. Let's talk if you can help in that area. And then funding opportunities. That's always an issue. And so we're working with a wide variety of partners. You saw some of them, but that's not all of them. And we're collaborative in our work. Our work is open source. It's freely available, and we plan to keep it that way. Next slide. And with that, I'm quite over, but hopefully it was a reasonable enough presentation. Happy to take any Q&A.
Thanks so much, Amit. Really appreciate it. We are coming up close to our time here, but I just wanted to highlight a question that Mary Sarah put in the chat, a little bit back and forth here around consent and ownership, but curious if you would like to weigh in here. Question is, consent is a challenge that impacts all sectors and all domains. To what extent do you think that complexity regarding ownership has slowed progress, and what can we do about it?
I mean, I think ownership of data has always slowed the progress, right? Like when you're talking about paternalistic attitudes toward data, my data, whose data is it? It's the patient's data. I think the big question is, how does consent follow the patient's data as well, right? And so we have a number of solutions, a number of companies looking at that. Like Timmy and I were on a panel with a company that had a federated consent platform. We don't know. I think this is an issue we're working out. But at the end of the day, ownership of the data, in my opinion, it's the patient's data, right? So they should be able to decide who gets to see what. They should also be able to revoke their consent. But these are technology challenges we still have to find ways to address.
Thanks, Amit.
I am just so thrilled to have found a partner in Shift, and thank you, Amit, for your just always there to willing to chip in and see the vision and what we're working towards as well. So we really look forward to working with you together as we both have sandboxes for organizations to play in. So more tools in the toolbox that we've never had before.
And my last comment is, I've spent my career working on like national interoperability, testing, certification. But 12 years ago, I moved to California. And so I'm excited to see what's happening with the DXF. I'm excited to see all the brain power we put behind it. And so just happy to help.
We're glad you're here.
Thank you.
Yeah. Our next slide, just as our call was starting today, Amit made a comment like, we're going to be talking about this for a very long time, right? And looking forward to this panel at HIMSS in 2026, already looking towards March of next year with Dr. Galvin, Timmy, Jolie Rizzo, and Evelyn Gallego on this very topic. So I think, Amit, this is definitely not going to be your only time presenting to Connecting for Better Health and having these conversations, because we expect to spend quite a bit of 2026 and beyond on these same topics. Okay, great. Well, thank you again for spending your hour with us, and appreciate the robust presentation. Can move ahead to our next slide. A few coalition updates as we get closer to 12 here. I mentioned at the top of today's meeting that we are sharing out our 2026 coalition survey to get your feedback on policy priorities for next year, as well as our programming and activities. All of you who receive our newsletter received this survey in your email on Tuesday. We'll also put a link to it in the chat right now. Takes just about 5 minutes, and we take your feedback really seriously. Your answers last year informed all of our meetings in 2025, who we invited to speak, the topics that we focused on. So we really look forward to hearing from you all. It's a few questions, and the first one is our proposed policy priorities for 2026. So if we go to the next slide, these 3 proposed policy priorities are included in the survey. These were informed by conversations with many of you, including our board of directors and others who weighed in on how we might amend and update the policy priorities from this year, 2025. And so we have 3 that we're asking for your feedback on in the survey. 1, advancing data sharing, trust, and accountability. 2, demonstrating impact on healthcare cost savings and affordability. And 3, integrating social services and behavioral health information. So please, please, please take 5 minutes between now and Thanksgiving to respond to the survey. If you have any questions, feel free to reach out to us over email. But we really value your feedback and look forward to hearing what you want more out of these Thursday meetings in 2026. Timmy, anything else you'd like to add here?
No, I think that this is, this is definitely an outcome of a lot of conversations with all of you. I think we're landing on a really great spot. And just notice that we had 4 priorities this year, and coming with more focus with 3 priorities will really help us, I think, drive even more progress going forward. So I really love this slate, but we really look forward to having your feedback on it as well.
Great. Okay, we can go to the next slide. And I'm going to bring on Frances Kiles from our Community of Practice team to provide a brief update on what the Health and Homelessness Community of Practice has been up to these last few weeks, and do a brief preview and demo of our new wiki live on our website. So Franny, thank you so much for being here. I'll hand it over to you.
Hi, everyone. Thanks, Stephanie. So I'm Franny Kiles, and I'm a senior analyst at Connecting for Better Health. So just to give a quick overview of our Health and Homelessness Community of Practice, the Community of Practice launched in August of 2025 with Connecting for Better Health and our partners, Homebase and Georgetown's Massive Data Institute. And the purpose of this community of practice is to support continuums of care and managed care plans and partners, design and test practical solutions to address data matching and sharing challenges that prevent people experiencing homelessness from receiving ECM and community supports. And so part of our community of practice, we host quarterly convenings that are open to anyone who is interested in joining. We had our first convening in October, where we shared some updates on our progress and some insights and learnings from what we've done so far. And then we also have monthly work groups for our MCP and COC pairs to work together to co-design and test solutions for improving data matching and sharing. And C4BH and our partners offer technical assistance tailored to each MCP and COC pair. And we just launched our first cohort of work group participants this November, which is super exciting. All right, next slide, Maya. Thanks. And so another important aspect of our community of practice work is to share out our progress and our learnings to other partners and stakeholders who may be interested in designing and implementing similar data solutions. And so one of the ways that we are doing this is through the launch of our Communities of Practice Wiki. And so on this Communities of Practice Wiki, users are able to access practical examples of what peers have been doing to address data matching and sharing challenges, along with other useful tools and resources. Users can also share their own progress, troubleshoot challenges, and exchange lessons and practices with their peers. And then, as well as stay informed about our community of practice updates and activities, and collaborate on our California county level data sharing resource, which I'll provide a few more details on during the demo. And so this wiki is run by Discourse, and so there is a login required just so that we know who's using it. But the sign up is super easy and fast, and it's free, so anyone is encouraged and welcome to join the wiki. And then I can go ahead and share my screen so I can do the demo.
I'm going to chime in here while you bring that up. And I just see Jim. There's so many of us that have been really eager to have this launch. I'm so glad. It's a big milestone for us, everybody.
Yes, yeah, super exciting. All right, can everyone see this? So I just first wanted to share, we also launched recently our Community of Practice C4BH webpage. So I just wanted to share how to access that as well. So in the upper right-hand corner on our menu here, there's a drop-down for the Community of Practice. So this first page is just an overview of what the Community of Practice is, looking at the quarterly convenings and the work groups. There's also a tab to join the Community of Practice, and just to reiterate, anyone who's interested in getting updates on our progress is welcome to join and attend our quarterly convenings. There's also a resource page just for more background resources on the COP. And then this last tab is how you access the Community of Practice Wiki. So this is just the landing page. And then if you scroll down, you can click on this button to join the wiki. And then here is the homepage for our Community of Practice Wiki. So this wiki was created thinking about, potentially launching future communities of practice as well. So this will be a landing page for future communities of practice in addition to the health and homelessness COP. But for users who want updates on the health and homelessness COP, you can click this health and homelessness category right here. And then that will take you to the latest topics that have been posted related to the health and homelessness COP. And then if you're interested in narrowing your search and seeing different categories within this community of practice, you can click on the subcategories right here. So you can see we have a resource library, which provides different resources related to the community of practice. We also have a category for quarterly convenings with resources from the convenings, as well as insights from our first quarterly convening. And then we have categories for each of our 3 work groups that we're going to be launching during the community of practice. And then we have a solutions, insights, and tools subcategory, which provides insights and tools from our work so far. So we've been doing some early work with Santa Barbara Continuum of Care, and so we've posted some early insights about that. So if you're interested in learning more about that, you can click on a topic and see an overview of some of our work and insights so far. And users are welcome to reply or react to anything that's been posted. And then our final category that I wanted to highlight as well is the California County Data Snapshot. So this snapshot is basically a living data table, interactive table that provides a high-level overview of data sharing initiatives by county in California. And so we encourage anyone to update this table with new information and also add rows for counties that have not yet been included. And so on this post, this is just a kind of a snapshot of the table. In order to edit the table, you have to go to the Google Sheet, but any edits that are made in the Google Sheets will be automatically updated on this table, so users can kind of scroll through and see what the current information on here is. So yeah, we encourage everyone to sign up and join the wiki. It's sign up is free and fast, so we hope that you'll sign up and keep up to date on our community of practice.
And let's just pledge that we do keep this wiki up. That snapshot was done back in, I'm looking at Mary, Sarah, and Sophia, who spent so much time on it last year. So it's been almost a year since we published it, and we constantly are seeing new work that's happening in our communities, and this is a great place for us to track it. So it's here, it's ours. We need to maintain it. Collective we.
Thanks, Frances. So excited and look forward to spending some more time playing around on it, and hope everyone else on the call can as well. In our last 2 minutes, Maya, you want to take us through a few news items and announcements, and then we'll wrap up.
Yes. So on November 5th of this year, the Department of Healthcare Access and Innovation submitted the California Rural Health Transformation application to the Center of Medicaid and Medicare and Medicaid Services with the goal to receive $100 million in funding. The effort led by HCI included many stakeholder interviews and analysis to really understand the needs of rural California and how to improve healthcare in those rural communities. The proposal calls for a more sustainable workforce, leveraging technology and modern data infrastructure. And we look forward to, or HCI will hear back from CMS by December 31st, and we will stay abreast of any updates. And then just a call out to the final TAC meeting of the year is next Thursday, which will round out the 4th focus group focused on identity management. Some of the key themes from past meetings in this series have discussed the minimum necessary information for identity matching, the need for human intervention to reconcile any mismatches and duplications in identity matching, and then also a push for the DXF to create a common framework for identity management for signatories. So looking forward to that last meeting of next year, or of the year for the TAC series. And that's it for this meeting. Just another reminder to sign up and register for our dinner that's happening next March 4th. We look forward to seeing all of you there, and a plug for our newsletter and then upcoming events.
Thanks so much, Maya. Can wrap up today's meeting. Final reminder to please take a few minutes to complete our survey. We really look forward to hearing that feedback. We won't be meeting in 2 weeks, so our next meeting is Thursday, December 11th.
Wow.
Yeah, and we'll have our final 2026 policy priorities to share with you all at that December 11th meeting. So thanks, everyone. Have a great rest of your Thursday.
Thank you. Happy Thanksgiving, everybody. Take care.